In this video, I want to talk about not why you may have PTSD, but actually, I want to give you 3 reasons on why maybe you actually don't. If this is your first time here, my channel is dedicated to educating veterans, service members, and their families about mental health. So make sure that you subscribe. The first reason that someone may not have a PTSD diagnosis is actually pretty simple, and that's they've never experienced a trauma. The term trauma gets thrown out there a lot, but what I'm talking about as far as trauma is I'm talking about the clinical definition of trauma for PTSD. And that definition is defined as exposure to actual or threatened death, serious injury, or sexual violence in one or more of the following ways: directly experiencing the trauma, witnessing in person the trauma happening to other people, learning that the trauma occurred to a close family member or close friend, experiencing repeated or extreme exposure to adverse details of the traumatic events, being exposed to things like on TV or the news do not count in this category unless it's actually part of your job. So if you haven't experienced a trauma that I just defined, then you would not receive a PTSD diagnosis. I make sure that I start off with this reason first, because the word trauma gets thrown out there a lot. And one can argue that there's a lot of things that are traumatic or can be viewed as traumatic that don't fit that definition. If you're getting value from this video, go ahead and hit that like button so YouTube will show this video to another veteran. Or better than that, share this video with a veteran buddy. At the same time, if your trauma does not fit that definition, you would not receive a diagnosis of PTSD. It's not that things like a divorce or potentially a toxic work environment are not traumatic and might even make somebody have those same PTSD symptoms. But clinically, without this trauma, you do not have PTSD. The next reason why someone will not receive a PTSD diagnosis is also a little tricky, and that's their symptoms are not connected to their trauma. Here's what I mean by this. So you can have nightmares, you can have intrusive thoughts, you can have changes in your mood, but if those symptoms are not connected to the trauma, then those symptoms, as far as the diagnosis of PTSD, do not count. So if you have nightmares, but they're not connected to that combat deployment, they're actually connected to your divorce, those symptoms or those nightmares do not count towards a PTSD diagnosis. The last reason why somebody may not receive a diagnosis of PTSD is that their symptoms do not reach the frequency or the intensity in order for a PTSD diagnosis. Having symptoms one time in your life is not enough for a PTSD diagnosis. The symptoms need to be at a certain intensity. They need to be at a certain frequency. If you say that you had a nightmare 2 years ago, even if that nightmare was connected to the trauma, that is not going to reach the frequency or the intensity for receiving a PTSD diagnosis today. Well, doc, all these seem actually pretty complicated. And you're right. They are complicated. This is why I don't suggest that anybody try to diagnose themselves, even if they are a mental health professional. What you want to do is, if you are struggling with PTSD symptoms or any type of mental health symptoms, you want to seek out mental health help from a mental health professional. They can help you tease out this stuff, because at the end of the day, even if you don't receive a PTSD diagnosis, that does not mean that you are not suffering. That does not mean that your symptoms are somehow less than. And it also doesn't mean that a mental health professional can't help you. Something to think about. If this video was helpful for you, and I hope that it was, please like it or consider subscribing to my channel if you want to learn more about mental health. But more important than that, as always, if this video was helpful for you, well, that means it can probably be helpful for another veteran or another friend or family member of a veteran. So I ask that you share it with them, because at the end of the day, that's really what all of this is about. One veteran trying to help another.